The inability to speak is perhaps the most distressing aspect of the tracheostomy experience. So it's a really good day for the patient when the Passy-Muir speaking valve comes on the scene. Speech-language pathology, or the speech therapist, will evaluate the patient's readiness to wear the valve, place it for the first time, and perform patient and family education. The Passy-Muir speaking valve is a one-way valve which opens for inhalation and closes on exhalation. That drives the air around the outside of the tracheostomy tube through the vocal cords and allows the patient to produce speech. Now, since we want air to move around the tracheostomy tube, it's very important that if it is a cuffed tube, that this cuff is deflated when the speaking valve is worn. You can see here that the cuff is doing its job and sealing the airway around the tube. So if the patient were on a ventilator, for example, we could achieve a good seal and maintain our pressures. Since that's not the case, we can use a 10 cc syringe to withdraw the air from the cuff. And now you see we have plenty of room for air to move around the tube. And the speaking valve simply pushes straight on. So it's an important part of your assessment to know if the tracheostomy tube has a cuff, as evidenced by the presence of this pilot balloon that you'll see outside the patient's chest, and if the cuff is fully deflated. Respiratory therapy is the primary manager of the cuffs. If you need any assistance or have questions, they're happy to help out and resource for that, because that is a very important safety feature. The patient does not sleep with the Passy-Muir speaking valve on. Respiratory therapy will remove it at night for sleep and replace it in the morning after suctioning the patient and ensuring that a cuff, if present, is deflated. Actually, it's preferable that the patient have an uncuffed tracheostomy tube when they're wearing a Passy-Muir speaking valve. Throughout the day, for routine suctioning and trach care, nursing can remove the valve to provide care and then replace it immediately after, because you are confident that the cuff is still deflated and it's safe for the patient to wear the speaking valve.